Armstrong.
And I'm Dustin Lukey. 10 to 30% of Mayo Clinic's COVID patients end up dealing with something called long-haul COVID.
Now, medical professionals have been studying people who suffer with these symptoms well after their infection. And today, they shared those findings at a press conference. News 19's Marcus Arsvold spoke with the director of Mayo's COVID rehabilitation program, and he joins us now to tell us more about it. So what have you learned?
Well, Heather, we know brain fog is a big struggle for some people who've had COVID, but today doctors went even further into detail to describe what that means. They say it's a struggle to find words, remember things, and what makes it worse is that many people are having a hard time being productive as they head back to the office. Doctors say some patients are still dealing with these health effects more than a year after infection. The best way to avoid any long-haul symptoms is simply not getting COVID in the first place, and medical experts say the best way to do that is to get vaccinated. But keep in mind, you can still test positive and possibly experience long-haul symptoms if you are vaccinated.
But it's rare. So that's a good sign. And in addition, the individuals that we have been treating and interacting with, they do seem to get better faster than the rest of our population.
Another thing about long haulers is they are not going to continue to test positive or spread the virus, even though they're still struggling with symptoms. Heather, he told me that the Delta variant has made long-term symptoms worse and overall made the pandemic last way longer than they initially predicted.
All right, thank you, Marcus. Now, Mayo doctors told Marcus they compare dealing with long-haul symptoms to training for a marathon while fighting the flu.